So you want to know how reliable is PSA testing? Well, in this video, you're going to learn all about PSA testing and whether it's reliable or not. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher. And this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your medical needs. By the way, if this is your first time to the channel and you like to get fact-based healthcare tips, go ahead and subscribe below. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Let's get into PSA testing and sort fact from fiction. The PSA, or prostate-specific antigen, is a protein produced by the prostate and it can be measured in the blood. It was labeled as specific, but this is absolutely false. It never was specific to the prostate or to prostate cancer. It was simply marketed as specific to give the perception of being specific for prostate cancer. Despite the many issues with this test, it is still used for prostate cancer screening and to monitor progress after treatment. So the FDA's criteria for approving tests or devices is dependent on them being safe and effective. Well, what about the PSA test? Is that safe and effective? Let's look. So the FDA's approval of the PSA as a prostate cancer screening test in 1994 was absolutely misguided because the specific label was false, the PSA levels of normal were arbitrary, the PSA level fluctuates and is unpredictable. As well, there are various PSA models in service and all calibrated differently, and the false positive rate with this PSA test was almost 80%. Even worse, at the FDA review hearings at the time, the PSA was approved, although it was absolutely clear that PSA-based screening did not save lives. Instead, strong financial interests were behind getting the PSA test approved for mass screenings. So there are many marketing claims as to why men should be screened for prostate cancer. Let's check some of them out. So these are some of the many marketing claims for why men should be screened for prostate cancer. Any man over 50 up to 70, that it's part of a general checkup, and that if you have any urinary symptoms such as dribbling or a slow stream, or if you have erection issues or have blood in the urine or semen, then you should get checked. Despite this marketing blitz for PSA testing and the Prostate Cancer Awareness Month, there was zero evidence to support these claims for testing. The PSA test and the prostate exam were both highly unreliable and failed to save significant numbers of lives. Instead, these tests were coupled with fear-mongering to railroad vulnerable patients into more risky testing without benefits. Remember, healthcare is financially driven. So where is the prostate located? So the prostate is located in front of the rectum, just below the bladder, as in the diagrams. It's not a very big organ, about the size of a walnut, and the urinary channel goes clean through the middle of the prostate. The PSA produced by the prostate helps fertility by liquefying the semen to allow sperms to travel to the egg. So the PSA is labeled specific to imply that it's specific to the prostate, but is the PSA found anywhere else? So the PSA, or prostate-specific antigen, is found in the prostatic semen. However, it's also found in the lining of the male urethra, in the bulbourethral gland, in female breast nipple aspirate, and in breast milk. It's important to underscore once more that the PSA, although labeled as specific, is absolutely not specific to the prostate or for prostate cancer. So the specific label in the PSA is false. How reliable then is the PSA when used to screen for prostate cancer? So the PSA is highly unreliable. It's not specific for the prostate or for prostate cancer. It has a false positive rate of 78% and is associated with false negatives, particularly when there's a high-grade prostate cancer involved, as many of these high-grade cancers produce little or no PSA. Furthermore, the limits of 0 to 4 as being normal are bogus and made up, and the PSA is easily raised or lowered without a cancer being present. And continuing on with this very unreliable PSA, a PSA over 4 does not mean prostate cancer, and a PSA below 4 doesn't mean no prostate cancer. The PSA can't distinguish between low-risk and high-risk cancers, and lowering the PSA doesn't lower your risk of prostate cancer. Shockingly, most prostate cancers are detected because the PSA was elevated by the enlarged prostate and not the cancer detected. So what are the common reasons for a false positive PSA? These are some of the many reasons why the false positive rate for PSA testing is in the order of 78%. The most common reason by far is that big prostates produce high PSAs. Other causes are urinary tract infections, whether symptomatic or not. Also, prostatitis or inflammation in the prostate, sex and ejaculation, a prostate exam or bike riding. All of these can cause the PSA to bump up temporarily. Importantly, you should never act on a single elevated PSA level, but get a series done after you've eliminated a cause. On the other hand, there are medications such as prostate medications and cholesterol medications that can artificially lower the PSA to give a false sense of security. So the PSA is not specific for prostate cancer and highly unreliable. Does PSA testing save significant numbers of lives? So although the PSA was FDA approved in 1994 despite being unbelievably unreliable, in that it simply failed to meet the criteria of being a useful screening test, PSA testing at 7 and 10 years failed to save significant numbers of lives. Subsequently, another study confirmed that PSA testing failed to extend life significantly. What about other markers used for prostate cancer screening and monitoring? Do they save significant numbers of lives? So there are many other markers in the business of prostate cancer claiming to be beneficial for prostate cancer screening and monitoring, such as PSA derivatives, PSA density, PSA kinetics, including doubling time and age-related PSA, pro-PSA, PCA3, and other blood and urine markers, including genome tests, indexes, and scores. However, there's no evidence that any of these markers for prostate cancer result in any significant life extension. So PSA testing is highly unreliable, and it fails to save significant numbers of lives. Are physicians concerned about this? So physicians have always been aware of the many false positive and false negative problems associated with PSA testing, and that PSA testing fails to save significant numbers of lives. However, they still lobbied to support the FDA approval. They labeled PSA testing as standard of care. They included PSA testing in their medical guidelines for localized prostate cancer. They promoted PSA-based screening, and they supported the Misguided Prostate Cancer Awareness Month. These dangerous programs failed to extend life and only resulted in serious harm to countless men. So PSA testing is highly unreliable and fails to save significant numbers of lives, but physicians still promote the benefits of PSA-based screening. Let's review. Here's a list of the common claims made by the prostate cancer industry as to why men should be screened for prostate cancer. That PSA testing can detect prostate cancers early, that cancers are easier to treat if detected early, allows detection when the cancers are localized, allows detection before it spreads, and early detection may save lives. Now, all of these claims sound very reasonable and believable, But we already know that PSA testing is highly unreliable and fails to save significant numbers of lives. So how can the evidence say no, but doctors still say yes? The answer clearly is that healthcare is financially driven, and since PSA testing for prostate cancer fails to save significant numbers of lives, the FDA approval for PSA testing should be rescinded. So what are the effects of the prostate cancer word and PSA testing on unwitting men? So what are the effects of PSA testing on the patient? Plenty of anxiety concerning the possibility of prostate cancer being a death sentence. This is usually coupled with a large amount of false hope and false promises, exaggerations and misinformations, and more risky testing and risky debilitating treatments that also fail to save significant numbers of lives. Fundamental to the marketing programs for prostate cancer is the deliberate use of the cancer word to instill fear in vulnerable and unwitting men. Never once did the prostate cancer industry ask the most fundamental of questions: where is the irrefutable and reproducible evidence supporting PSA-based screening for prostate cancer? Instead, they've simply created a public health disaster. So let's recap. In this video, how reliable is PSA testing? You learned that PSA testing is highly unreliable. It fails to save significant numbers of lives and commonly leads countless men to great harm. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.